A warm welcome, ladies and gentlemen, to today's virtual workshop that AFRAA is staging in collaboration with Africa CDC. Thank you for taking the time off your busy schedules to join us. My name is Maureen Kahonge, Senior Manager, Business Development and Communications at AFRAA, and I will be your host for today. Today's workshop is being held under the theme Building Momentum for Systematic Testing and Safe Reopening of Borders. The global health public crisis continues. Despite slight signs of improvement towards the end of 2020, the COVID-19 pandemic has intensified across the globe alongside the spread of new and more aggressive variants of the virus. The resurgence of cases and fatalities has prompted governments to reinforce strict lockdowns, border closures, as well as travel restrictions, resulting in even larger social and economic ramifications than initially predicted. Globally, the recovery of air transport has virtually stalled, severely hampered by the renewed outbreaks, consequential patchworks of travel restrictions, including quarantine requirements, and wavering travelers' confidence. On the upside, a foreseeable horizon to the end of the crisis has been shaped by favorable news on the substantial progress in the development of vaccines, the approval and the distribution. Aviation plays a crucial role in the safe, quick, and efficient transportation of vaccines worldwide. In awaiting the vaccination of a large majority of the global population, states may need to resort to other mechanisms to restore the flow of people and goods, as well as business activities, while remaining compliant with the public health risk management frameworks in place. In light of these developments, the ICAO Council Aviation Recovery Task Force, CAT, reconvened early 2021 to review and update its guidance for states to counter the headwinds and accelerate the momentum for aviation restart and recovery. Following the emergence of the virus variants, progress in vaccine rollouts and new tools for combating the virus, the work of the CAT has targeted specific issues related to testing and vaccination of passengers as part of states' multi-layer risk management strategy. CAT also took into account the position of the WHO that national authorities and conveyance operators should not introduce requirements of proof of COVID-19 vaccination for international travel as a condition for departure or entry. To complement the ICAO guidance for Africa, the work being done by various stakeholders and partners, specifically the Africa Against COVID-19 campaign, and the work by the Africa High-Level Task Force on the Recovery of the African Air Transport Industry, which was set up to serve as an advisory body for the campaign, is important to note. AFRAA is a member and is actively involved in the work of this task force, which comprises of various industry stakeholders and partners. Today, we will learn more about this and more during the discussions. We're happy to announce that we are joined by over 160 participants from Africa and beyond for this webinar. Please feel free to let us know where you're joining us from through the chat box. A warm welcome once again to today's deliberations. As we start off, a few housekeeping announcements. I know by now we have done so many webinars, we are used to this. For better quality of the session, please note that your audio and video functionalities are muted, except for the presenters. During the open session, we'll activate this for those who wish to ask their questions live. We'll have the presentations and we'll open the floor for the questions at the tail end of today's session. I now take you through the event agenda. Today's webinar will run for a total of 1 hour and 30 minutes. I've covered the welcome and introduction. We'll have remarks and the state of the industry by Mr. Abderrahman Berthe, AFRAA Secretary General, followed by remarks from Africa CDC, which will be made by Dr. Mohamed Abdulaziz, who is the head division of surveillance and disease intelligence. We'll have a 20 minutes presentation by AFRAA on measures for building confidence in flying, the ICAO CAT recommendations, which will be done by AFRAA Secretary General. By a presentation by Africa CDC on the Saving Lives and Economies campaign, which will be done by Ms. Marion Kangume, Public Health Fellow, Social Affairs. Following this presentation, we'll have a 30 minutes open session where we'll take questions from the floor. And we'll have a 10-minute wrap-up and closing towards the end. To start us off, I have the pleasure to invite AFRAA Secretary General, Mr. Abderrahmane Berté, to make his opening remarks. Mr. Berté, you have the floor.
Thank you, Maureen. Good morning or good afternoon to everyone. I wish to thank all attendees for availing your time to attend this meeting. The theme today is building momentum for systematic testing and safe reopening of borders. I thank Africa CDC for the presentation they will make on Africa against COVID-19. This webinar is timely organized with the objective to update members on latest informations on ICAO CAT recommendations and vaccination protocols. African airlines are in a difficult situation. They lost more than $10.2 billion revenues in 2020. We call for a safe reopening of borders as soon as possible for a quick restart and recovery of air transport. We also call for an harmonization of health safety protocols across the country. All participants, fruitful discussion today. Thank you all.
Thank you very much, Mr. Berté, for your remarks. We now have the pleasure to welcome Africa CDC, Dr. Mohamed Abdulaziz, Head Division of Surveillance and Disease Intelligence, to make some welcome remarks. Dr. Abdulaziz, you have the floor.
Thank you so much for giving me the floor. Good morning and good afternoon to the distinguished participants of this very important webinar. Our sincere gratitude goes to AFRAA and to the Secretary General Abderrahmane Berté for inviting Africa CDC to this important webinar. When the director of Africa CDC joined Africa CDC in 2016, the first thing in my first discussion with him, he said, he mentioned a very important statement. He said, Mohammed, health security is not just health security, it's socio-economic security. I did not understand fully until 2020. And even before the COVID-19, he extended his arm to reach out to airlines, trying to set up a system that would have been very helpful for the continents when COVID-19 came. However, it was difficult then for people to understand the extent to which a pathogen from any part of the world could affect us and bring down everything that we've worked for in a very long time within a short period. And I think COVID-19 has indicated that. That is why Africa CDC lay a lot of importance on the partnership we're having with organizations like AFRAA, and we'll continue to ensure that this partnership endures even post-COVID, because we now live in a world that is global and people have to move around. for the sake of our economy, for the sake of our people. We need to ensure that we have open borders, and it's just like we are now doing with the continental free trade zone that cover the whole of Africa. We want to ensure that our continent will continue to be open for business, but we will do that in a safe and a way that is safe for our people and safe for everybody involved. Just to remind you that as of 2nd of March, more than 14 million cumulative cases of COVID-19 have been confirmed, with more than 2.5 million COVID-19 related deaths. In Africa, the first case was reported in Egypt. However, it has spread to 55 member states of the continent as of 3rd of March. This led the African Union Commission through the Africa CDC to a livelihood campaign in August 2020 to explore means by which the continent responds to this unprecedented disaster in a holistic way, and working with partners like AFRAA, like ICAO, like WHO, in ever-expanding partnership that we ensure that we are able to contain this pandemic and at the same time continue to allow our people to trade freely without disruption. Later in our presentation, Marion will be giving a more detailed account of what we have been doing. We really cherish our partnership with AFRAA and the rest of our partners, and thank you very much for having us. Over to you, moderator.
Thank you very much, Dr. Abdulaziz, for your remarks. We now proceed to the first presentation of today on the theme Africa against COVID-19, ICAO CAT recommendations. This will be done by AFRAA Secretary General. This presentation will cover ICAO CAT measures and recommendations, and as well as the harmonization of protocols. Mr. Berthe, you have the floor.
Thank you, Maureen. Following the outbreak of the coronavirus, the ICAO Council put in place an aviation recovery task force. And today my presentation will be about the ICAO CAT measures and the recommendations, because so far we have the 3 phases of the CAT, and also the second part of the presentation will be harmonization of protocols. Next slide, please. So the CAT 1 report was published in June 2020 with 11 recommendations. The CAT 2 in November 2020 with 3 recommendations. And recently the CAT 3 report on 10th of March with a revision of recommendation number 12 and 14 of CAT 2 and 6 new recommendations. So for CAT 1 measures, I don't want to go through all the 11 recommendations. There were some measures regarding the safety where states were authorized to temporarily depart from ICAO safety standard, but must do so in a manner that will not compromise safety and security. The second part is about public health related measures requiring states to establish public health procedures aligned with the guidance included in the document, which was the takeoff guidance for air travel through the COVID-19 public health crisis. Next slide. And then we had some measures related to security and facilitation, requiring states to enhance cross-sectoral coordination by establishing a National Air Transport Facilitation Committee or equivalent, because COVID-19 is involving many sectors of business and industries in countries. The last set of measures was about economic and financial, and the advice was to have them inclusive, targeted, proportionate, transparent, temporary, and consistent with AFRAA's policies. Next slide. Then came the CART 2 recommendations. The recommendation number 12 said states should put in place the necessary measure to mitigate risk associated with prolonged regulatory alleviation and should not extend alleviations beyond 31st March 2021, and unless circumstances dictate otherwise. The recommendation number 13 was stating that testing is not universally recommended by public health authorities as a routine screening method. But however, states contemplating testing in their COVID-19 risk management strategy should apply the approach outlined in a document which was published by ICAO. On recommendation 14, it was requiring states to consider the formation of a public health corridor, actively share information with each other states to implement public health corridors in a harmonized manner. Next. Now we come to the CART 3, the last one, which is very important. So CART 2 were setting a deadline of 31st March 2021 for safety regulatory alleviations. Now the CART 3 is stating states that are in need of alternative actions to enable service providers and personnel to maintain the validity of their certificates, licenses, and other approval during the COVID-19 pandemic should use the targeted exemption system from 1st April 2021. It means that there is an extension of the deadline of 31st March 2021. Then there is a revision of recommendation number 14 also regarding the public health corridor, and some specific PHT-specific tools are published on the ICAO website, and an application providing a template public health corridor arrangement between states. Next. So now the new recommendations from CART 3. The recommendation number 15, very important, is regarding the dangerous goods by air. There is an addendum, another numbers 1 and 2 to the technical instructions for the safe transport of dangerous goods by air without delay in order to facilitate the transport of COVID-19 vaccines. On recommendation 16, this is also very important because cargo operations are very important to carry vaccines. It's requiring states to consider temporary lifting of restrictions to air cargo operations, including but not limited to granting extra bilateral rights, in particular for all cargo services. Next slide. The recommendation number 17 is about testing. Member states should implement testing certificates based on the protocol minimum data set and implementation approach outlined in the manual on testing and cross-border risk management measures. So there is a document published by ICAO on testing. On recommendation 18, member states should facilitate access for air crews to vaccination as quickly as possible. This is very important because crews are on front line. It's very important to have them vaccinated as soon as possible. Recommendation 19 is about vaccination. The recommendation is stating that vaccination should not be a prerequisite for international travel. At such time as evidence shows that vaccinated persons will not transmit the COVID-19 virus or would present a reduced risk of transmitting the virus, member states could consider exempting such persons from testing and or quarantine measures. I'll come back on this recommendation, very important. And lastly, the recommendation number 20 regarding the CART guidance to be taken into consideration by states administrations. Next slide. Now, regarding harmonization of protocols and the vaccine passport, some states in different world regions have introduced or are in the process of introducing vaccine passports as a prerequisite for air travel. So far, the vaccine has not been made widely available globally as observed by the WHO. And the African continent has most of its citizens not having immediate access to vaccines. Therefore, imposing the vaccine passport will amount to discrimination of certain group of populations and goes against the intent of the Chicago Convention. So I want to inform you that on this matter of vaccine passport, AFRAA and other stakeholders under the leadership of the African Union Commission and the ACDC are working on a position paper. Next slide, please. So just to give you some data, the source is ACDC on the status of vaccine acquisition in Africa. So far, we have only 8 countries with more than 60% of vaccine acquisition in Africa, namely Morocco, Guinea-Bissau, Egypt, Ghana, Lesotho, Gambia, Zambia, Nigeria. We have 6 countries with no data known, 26 countries with less than 30% coverage, and 17 countries between 13 and 60% coverage. I remind you that the target of African Union and ACDC is to reach a 60% vaccination rate by end of 2022 to get to the herd immunity. So we are very far from this target. And imposing a vaccination certificate to air travelers will be a challenge for African air transport. I thank you for your attention.
Thank you very much, Mr. Berthe, for sharing with us detailed insights of each of these recommendations under the ICAO CART. Next, we have a presentation by Africa CDC, but before I go to that, just to remind you that we can have your questions through the Q&A tab, which we'll respond to after we are done with the second presentation. The presentation by Africa CDC will cover the call to action that has been made by African ministers responsible for health, ICT, and transport, made to African states to work towards harmonizing pre-entry and exit requirements for cross-border travel to increase mutual recognition and cross-border information exchange. This call to action comes under the umbrella of the Africa Against COVID-19, Saving Lives, Economies, and Livelihoods campaign. The call recognizes the need to define our new normal by striking a balance between saving lives, reopening of economies, and revitalizing livelihoods within the African continent. The presentation will be made by Ms. Marion Kangume, Public Health Fellow, Social Affairs at Africa CDC, who will tell us more about this call to action and the work of the multi-sectorial Africa High-Level Task Force, as well as the specific elements that are addressed by this call to action to safely reopen all borders. Marion, you have the floor.
Thank you, Maureen. Good morning, good afternoon, participants on this important webinar. Africa Against COVID-19. Africa Union, through Africa CDC, launched a campaign called Africa Against COVID-19, Saving Lives, Economies, and Livelihood for safe opening of borders and travel. And this was launched by the ministers responsible for transport, responsible for health and ICT, and confirmed by the AU. And this campaign encompasses of three major topics or major issues. And the first one is borders and travel. And the main goal of this topic or this issue is minimizing the spread of infections within and across the borders by creating a public health safe corridor for travel. And this can be accomplished through registration of COVID-19 testing for border crossing, supported by the PACT initiative, which is partnership to accelerate COVID-19 testing. And this emphasizes on tracing, testing, and treatment of the COVID-19 patients. Deploying a cross-border tool or platform which ensures that COVID-19 information is distributed, including testing results, and the mechanism for collecting additional data and evidence. And in this, Africa CDC have put up a study on serosurveys in the member state and rapid mortality surveillance to gather more research, to gather more information and evidence on the impact of COVID-19 on the continent. Next slide. The other component of this campaign is saving economies. As we are all aware, COVID-19 affected a lot of economies, including tourism, as most of the things were put at stand here. And the main goal is to minimize impacts of the pandemic on livelihoods and economies. And this can be achieved through employing digital frameworks for tracking and sharing of critical information to support creation of safe public health corridor, supporting mutual recognition of health information provided by state parties within an existing framework for protecting borders and framework, which includes test validity of COVID-19 for travel, strengthening risk communication to address misconceptions and infodemics embedded in. Next slide. The third component of this campaign was and is about education and to ensure safety and safe reopening of schools, including developing school opening safety plans and allocating resources for protection of students and staff on the continent. and establishment of engagement of multi-sector committee to continuously monitor safety of students and staff, assess risk and advise accordingly, mobilize resources for continuous improvement of the infrastructure. Next slide, please. A part of this campaign, Africa CDC, together with its main partners, Econet and Panabios, launched Africa CDC travel platform, which is a digital platform to simplify verification of public health documentation for travelers during exit and entry across borders. And the aim was to ensure a secure, standardized, proof, transparent digital platform for easy verification of travelers from across borders, and also to give confidence to the aviation and airline authorities, and to ensure that we don't import cases from one country to the other. Next, please. And this platform has mainly 3 components, that is travel requirements and exit requirements, where you go on the website and you're able to check the travel bans or travel requirements in the country you intend to go to and the country of your exit. And then you upload your digital test results, which are verified in the system, and you're able to have them. And then the health certificate report. This includes COVID-19 PCR test certificate, which confirms you're free from COVID-19. Next slide. And in October 2020, still the ministers responsible for transport, ICT and health convened a virtual meeting where they emphasized the role for harmonization of pre-entry, exit requirements as we safely open our borders. At that point, most of the countries were moving into opening of borders and allowing trade and travel. And the African Union Commission through Africa CDC and the partners who are in this slide, including IATA, AFRAA, WHO, AFRAA Champions, ICAO, and Airlines Council Association and AFCAC, they committed to making sure that these recommendations are drafted and published for safe reopening of borders. Next slide. And from this multi-sectoral task force, which was composed of all those trusted partners, 3 major recommendations in 3 areas were agreed and have been published, which include harmonization of pre-entry and exit requirements, maintaining safe public health corridor before, during and after travel, and compliance to multinational treaties and set of regulations. When we go to pre-entry and exit requirements, the task force is calling to action for the government to consider applying alternative measures to closure and mandatory quarantine. This can be done through instituting and strengthening the recommendations, which are non-pharmaceutical, that can be followed during, after, and before travel, which include social distancing. In doing so, the member states should consider applying it in a stepwise manner. The other recommendation on pre-entry and exit requirements is harmonization of alternative measures to allow mutual recognition and trust of information that is shared about travelers among the member states. And in this, one of the major recommendations is harmonization of the validity period for COVID-19 PCR test results. And we recommend that the countries should consider 5 days as reasonable and feasible validity period without, yes. And then the third, still about pre-entry, is consider alternative testing protocol, which utilizes rapid diagnostic tests as compared to PCR in instances where testing is not readily available, or where the result delivery takes a long time turnover. And this was in consultation with the Africa Task Force by the African Task Force for Coronavirus Disease Response Laboratory Working Group, which recommends that the overall public health impact of the rapid diagnostic test in assisting to maintain the public safe for travel during and after travel. And another big recommendation on harmonization of pre-entry and exit requirements is for the states not to impose COVID-19 vaccination as a mandatory travel criteria until there is satisfactory access to the vaccine, until there is reasonable vaccine coverage and sufficient evidence on the continent, and then until the guidance on the use of the vaccine for travel is readily available. As most of us may be aware, especially for Africa, it will be so hard and difficult for us to have majority of our population vaccinated against COVID-19. And to impose a vaccine certificate for travel will be a discriminatory action. And we explore the governments and member states to maintain safe public health corridor before, during, and after travel of the travelers through hand washing, wearing masks, social distancing, and sanitizing. And we also reminding the member states to comply with the recommendations and regulations, especially compliance with Article 40 of the International Health Regulations, which emphasizes and recommends that member states or governments should not impose or charge travelers for interventions which are meant to protect public health. And again, this full document can be accessed on that website. Thank you so much for your attention. Over to you, Maureen.
Thank you very much, Marion, for your presentation, giving us detailed information regarding the Africa Against COVID campaign, elaborating on the key recommendations. And now we'll also take this opportunity to thank Africa CDC for all the collaboration and kind support, and also the other stakeholders who we are working with, specifically those who we are collaborating with under the umbrella of the Africa High-Level Task Force on the safe reopening of borders. At this juncture, we now proceed to the open session where we'll take your questions and comments for the next 20 to 30 minutes. The first question, which we received before the webinar, from Samuel Njoroge, and it's addressed to AFRAA Secretary General. Where do we see African aviation growth amidst COVID-19 pandemic beyond 2024?
Okay, thank you very much for this question. It's not easy to answer. it's difficult to read in the crystal ball today. And there are so many parameters which can impact the restart of air transport in Africa. So if we look at the plan for vaccination, we will reach the herd immunity by end of 2022. It means for me, we will not see a restart before end of 2022. The restart will come later, but it's difficult to say when, because the restart will depend also on the recovery of African economies, because all sectors of economies are impacted. And also, it will depend on the health of our African airlines, because as you well know, African airlines are in a very difficult situation financially. We have been calling for actions since March 2020, and still there are not enough slots coming to airlines. We have seen some support to state-owned airlines, which are not enough, and the private sectors are left behind. When I talk about support, it's not only put cash on airlines. There are a set of measures which can mitigate the financial situation of members. So to conclude, I think the restart will come in 2023 or 2024. Thank you.
Thank you, Mr. Berthe. I hope this addresses your question, Samuel. A quick reminder that we are taking the questions through the Q&A tab. Please feel free to send us your question, and we'll do our best within the available time to respond adequately. The next question we have from Air Mauritius, Yashna. We understand that a vaccine certificate is considered as discriminatory at this stage due to the reasons explained. Will the separate treatment for vaccinated travelers be considered? For example, the no requirement for PCR test and quarantine. Yes.
Yes, I can answer this question. There is one of the recommendation of CAP 3 saying that the ICAO is not recommending vaccination as a requirement. On the same recommendation, it says that the traveler which have vaccination can have a specific treatment different to avoid quarantine and so on and so forth. So this can answer your question. If you take the CAP 3, there is a recommendation which is giving explanation of that.
Thank you, SG. We have a hand raised from Samanduku Kameko. Samanduku, we have enabled your microphone. Please take the floor.
Thank you. Good morning, everybody. Thank you for the webinar. We would like to know what if African travelers are imposed the vaccination, the COVID vaccination passport, what will be our reaction? Thank you.
Okay, thank you for this question. We all know that the vaccination will come, maybe later. At one stage, we will have a requirement for COVID-19 vaccination. What we are saying is that right now, because there are so many people who have not access to vaccines, it's premature to put as a requirement a vaccination certificate for travelers. And as I said, we had a meeting, high-level meeting, last Friday with African Union and all aviation stakeholders on this matter of vaccine passport. AFRAA and the African Civil Aviation Commission, we drafted a common position paper. Now we will finalize, after this high-level meeting, a position, African aviation position. With that, African Union Commission will have to engage with the region, the states, where there is this requirement of vaccine passport, to ask them to remove these requirements, waiting the time where we will have vaccine access to African citizens. At the same time, we know that it will happen, so we need to prepare for that. The states need to accelerate the pace of vaccination. As you have seen on one of our slides, the pace is so far very slow. And this will be part also of the recommendation stakeholders will put on the table for the African Union Commission.
Thank you, Mr. Bertel. We have from Tagangola a hand raised from Ademar Fahia. Ademar, you
No, sorry, everything is okay. I'm okay already. Yeah,
okay.
I was good. Thank you.
Thank you. To Africa CDC, this one is coming from ICAO. What effort is Africa CDC making in terms of coronavirus expansion, since some countries have only one registered laboratory, while others have more than 80? Malion?
Can you repeat the question, please? Thank you.
Okay, the question is, what effort is Africa CDC making in terms of coronavirus expansion, since some countries have only one registered laboratory, while others have more than 80?
Okay, thank you, Maureen. Africa CDC, in partnership with Panabios, Econet, and the member states, we are exploring through the member states the registered labs which are approved. So even if there are 20 and approved, they will be on the Panabios system. Or when you upload your test results from that lab, it means that lab is authentic. If the country has only one lab that is testing, then that one is okay. And we are also looking at adding information related with vaccine management for the member states who are enrolling on that thing. And most so on this Friday, 26th, we are planning a consultative meeting with all technology companies and telecommunication companies who would like to partner with us in expansion of the platform. Thank you. I hope it answers your question.
Hello, this is Mohammed Abdulaziz. Can I add to what Malion just said?
Yes, please.
Okay, thank you. Well, so thank you very much, Malion. In addition to what you just said, at the onset of this pandemic, when we had the first case in Egypt, only 2 countries on the continent could make a confident diagnosis of COVID-19. That's Senegal and South Africa. And within 4 months, Africa CDC conducted 3 sets of training in Senegal, in South Africa, and we've been able to ensure that all the 55 member states of the continent now have the capacity to make a diagnosis of COVID-19. Furthermore, we have supported many countries to be able to develop the capacity of many other laboratories in that country to be able to make a diagnosis of COVID-19. For Saving Life, Saving Economy, we are encouraging the process of our partners, Panabios and Econet, to onboard these laboratories for safe, for trusted testing, so that any African traveling any part of the world, it will be easy for you to verify the laboratory test, and the questions of the status of the laboratory test should not prevent any Africa from going anywhere within Africa and beyond. Thank you. Over.
Thank you very much, Dr. Abdulaziz. The next question is still for Africa CDC and from the CEO of LAM Mozambique, Joao George. The question is, we are being approached by sales representatives of the quick PCR test to be done prior to boarding. Is there a public health benefit to this kind of testing?
Oh, thank you very much. So far, our protocol says exactly the way Malian said it. We want pre-tests that will be valid 5 days before 5 days before the day of the travel. We know the airlines and some industries are doing some other form of testing, but we are looking at it, and as we have a position on that, we will communicate to all partners. Thank you, Anula.
Thank you very much, Dr. Abdulaziz. The next question we have again to CDC. Thank you for sharing actions of Africa CDC. Please update us on the status of epidemic in Africa and what has been done and what has not been done when it should have been done. Thank you.
Thank you so much. An excellent question. And it goes to show that in Africa, we should always be ready for epidemics. Pandemic is a form of epidemic that spread around the whole world. Right now, we are dealing with Ebola in 2 member states, in Guinea, in West Africa, and in DRC in Central Africa. We have other disease outbreaks in different parts of the continent that we are following and monitoring. The most important thing, and this is where partnership with everybody on this webinar is important, is that we must be prepared to deal with the consequences of these outbreaks, these pandemics, in such a way that the effect on our socio-economic life should be kept to the barest minimum. And the only way to do that is not just a public health problem. If it's a public health problem, we would not be in this forum where we have airline industries, we have other partners. It is all of us working together, doing our bits, agreeing, just like we are doing now, to some set of actions that we need to take prior to the pandemic. From the airline, from the service company, from laboratories, from our government, from Africa CDC, from WHO, all of us agreeing together. These are this minimum set of things we need to do to ensure that we reduce the impact of these outbreaks on our people. Don't forget that because we are now moving deeper and deeper into African rainforests. What does that mean? Our population will be coming into contact with newer and newer diseases that we don't know. And all what if you take is somebody just taking a flight to another country. And the same thing we saw happen, and today we are dealing with COVID-19. However, we have ways and means of managing that. And the ways and means involve that we all work together as partners to limit the effects of these outbreaks and pandemics on our economy, on our lives. And if we do that, I'm telling you, we will be able to continue to function while at the same time limiting the effect of these outbreaks, epidemics, and pandemics on our socio-economic security. Thank you, and over to you.
Thank you very much, Dr. Abdulaziz. We seem to have a lot of inquiries directed to Africa CDC. The next question, again, is still to you. Countries in Africa, 26 countries in Africa are 30% down in terms of vaccination, and 6 African countries have no data for vaccination. What is Africa CDC position on this, which seems to be very dangerous?
Again, thank you for this very important question. Let me assure the person who asked this question that not just Africa CDC, not just the African Union, but at the highest level, the head of states are working day and night to ensure that vaccines come to Africa. I tell you, the meetings that we are having in Africa CDC is being attended by head of states, is being attended by the highest level people in the continent, including the chair of the African Union Commission. And there are 2 very important means of the vaccines acquisition. We have the WHO COVAX facility that says we will get a minimum of 20% for Africa in terms of vaccine. Taking that forward, Africa CDC developed the AVAT mechanism that will ensure, just like the Director General said at the beginning of this webinar, 60% vaccine acquisition from member states by 2022. We are having a slow start. However, it is a solid start. These vaccines will continue to come and will continue to push until we achieve the 60% level that is necessary for herd immunity. If you look at what is happening all over the world, vaccines are a very serious issue. We have companies that have sold out all the vaccines. Powerful nations with more economic endowment than Africa have all gotten, but we are making every possible push to ensure that Africa gets the vaccines that is required. Through both the COVAX and the AVAT facilities, the Africa CDC is pushing on all angles to ensure that every country, every citizen of Africa will be able to get vaccine at least to the level of 60% coverage of our population. Thank you very much. Over to you.
Thank you very much for adequately answering the question. The next question is Seychelles and a few other countries have implemented a health travel authorization platform where all travelers upload documents before travel and get authorization before they travel. This is a pragmatic approach to go as opposed to the umbrella trusted traveler platform. I think this one is more of a comment. I don't know if you have any remarks to make on this comment, Dr. Abdulaziz.
No, not really. Just to say that we welcome all initiatives that will help our citizens to move around. Seychelles, what they do is, if it will help the process of enabling Africans to move around, that is excellent. That's what we want. We'll continue to support all of those measures by member states. However, for the issue for moving around the continent and beyond in a seamless way, it goes beyond one country. It has to be a multi-country approach. So much so that if somebody leaves Johannesburg, is coming to Nairobi, for instance, there should be no problem of whether his lab test is genuine or not after he has boarded his flight. He should not be trapped in Addis Ababa, for instance, and because a system says it's 2 days instead of 5 days validity. And these are some of the areas that we really appreciate the partnership we're having with AFRAA, with ICAO, with all the other partners working in this area. We will continue to work with every member state, support their efforts in setting up processes that will make Africans to travel around in a safe manner, in a way that they will not bring COVID to their country, to the country they are going to, and they will not take COVID from the country they are going to another country. And in a trusted way that will give everybody the rest of mind to continue to operate seamlessly. Thank you very much. Over to you.
Thank you very much, Dr. Abdulaziz. The next question for AFRAA, as you grab a glass of water. Mr. Befte, with regards to harmonization of travel requirements, we can see that different states still have different protocols. For example, the validity period of the PCR test is different. What measures could be introduced to reinforce the harmonization of travel requirements by African member states? Okay, I can take this one. Just to highlight what has been presented in the Africa CDC presentation by Marion under the Africa high-level task force, where we have the campaign. The call to action addresses this need to have harmonization of the protocols across all states. So among the three main recommendations, the task force is actually working on ensuring that, and actually calling upon states for them to ensure that they harmonize all travel entry and exit requirements so that we can have seamless travel by passengers. Yes, Mr. Betty,
okay. To complement the recommendation of the task force, I talk about the high-level meeting we had on Friday also on putting in place the common position of stakeholders. At the same time, we are recommending to keep the current PCR test. We also will put on the paper a requirement to harmonize the current protocols. So this is something we have highlighted to African Union Commission also, as well as the task force Maureen was talking about. So it is something we will continue to follow up. The thing is that in Africa, we make a recommendation, but it depends on the goodwill of states to implement these recommendations. This is the main issue. But however, we'll make this recommendation to harmonize protocols. Thank you.
Thank you, SG. Now back to Africa CDC. This question is regarding the technology applications. The question is the Africa CDC trusted travel platform connected, or will it connect in the future to any one of the solutions providing digital health, for example, the mobile applications, to make the test verification easy and seamless?
Thank you very much for this important question. May I use this opportunity to invite everybody here to a consultative meeting with the mobile telecom company and the technology providers for the trusted travel, which is going to be on Friday, 26th. Marion, please, can you share the link to on the chat before the end of this meeting? All the questions all the questions that has just been asked, we will trash it out in that meeting. Obviously, what are we talking about? We have a public health problem that is affecting our continent, impeding the way we do trade, impeding economy. We know the public health problem, but we need innovators. We need the telecom company. We need other partners to come with us, sit on the same table, and develop innovative solutions to these public health problems. And that is what we are doing right now. And as far as the connection, it will definitely be connected to all of that. We're working with Panabios and Econet. Most of these things have been discussed and they're in the process of rolling out. For Panabios, they are already are live in Nairobi, in Kenya, and in Ghana. More countries are coming on board, airlines are coming on board. And these are some of the things that we believe will outlive COVID-19 and will make our continent more prepared for any other pandemic. Make no mistake about it, we will have, it may not be in our lifetime, but if you go into history, you will discover that pandemics have been happening in regular cycles. So it's not a matter of whether it will come, it is when or if it will come. So these are some of the things that we will use to fight the next pandemic when it comes. Thank you, and over.
Thank you very much, Dr. Abdulaziz. The next question is more AFRAA and Africa CDC. Thanks for all the efforts being done. Is Africa working together in ensuring the safety of the vaccines being delivered to Africa continent? Do we in Africa have plans of coming with vaccine production within the continent?
This is an excellent question. But you can see, even from the richness of this webinar, that Africans are working together in a way that we've never done in the past. And we will continue to work together because our socioeconomic security depends on it. We have now working Africa CDC with airline industries, with WHO, with service providers, with telecoms, with innovations, with government, and everybody to ensure that we are able to take care of this pandemic while at the same time our economy continues to move. Now, talking about local production of vaccines, this is one area that Africa CDC is now considering a priority. A priority, we are working with our developmental partners, even within the African Union, we are working with AU NEPAD, we are working with different governments, we are working with research institutions. Our head of state have set up a high-level regulatory agencies that will ensure that the issue of local production of vaccine is brought back to the highest level. In the past, Africa used to produce vaccines, but maybe now because of the less emphasis on it, we see less and less country producing vaccines. And this is what we want to reverse. We want a situation in which Africa can be self-sufficient in the production of vaccines, not just vaccines, but effective and safe vaccines for our population. We've noticed and we've understood the various risks, the rumors, and this is following this vaccination, and we're tracking them. We are also trying as much as possible to educate our continent on the need to be vaccinated so that Africans can develop herd immunity. I want to make it clear to our audience, distinguished audience here, that the only way we can ensure that we control this pandemic, even before a new variant come up, is to ensure that we have vaccinated a large amount of people in our community that will prevent transmission. The more we have transmission, the more the chances that we'll have another variant, because the virus likes to jump from one human being to the other. And as it's jumping from one human being to the other, the chances is that it can change its composition. And if it changes that composition, there is a chance that it can change to a more virulent type, or like the one we've seen recently the one that can transmit more easily among our people. So the only way or the most viable way to ensure this is done is to ensure that we that can provide herd immunity to our people and therefore stop this pandemic in its. Thank you so much. Over to the presenter.
Thank you, Dr. Abdulaziz, for the response to that question. The next question, we have a hand raised from Sudan Airways. Mirghani Mahmoud, you have the floor. Mirghani Mahmoud, you can unmute your microphone and take the floor.
Hello, thank you for the opportunity. We see vaccine is one of the solution healthily and economically. Why AFRAA you not make more effort with the another organization like World Health Organization or the any other body to access this vaccine? Even if we know that all African airlines in a difficult situation, and also we saw that passengers are suffering for testing, even if in their countries if they found it it is negative, and for the other countries they found it is negative, they suffering economically and healthily. Why there is no more effort for this solution? And thank you.
Sorry, could you please repeat the question?
Okay. We see that a vaccine is one of the solutions, healthily and economically. Why AFRAA not make more effort with the other organization like World Health Organization or other body to access this vaccination for all African airline? And we know that they are in a difficult situation. Sorry, and also we know that also the passengers are suffering for this testing of the COVID-19. If he found it here in the test in his country is negative, and in another country he found it is positive, it is suffering economically. Why will you not make more efforts for the African airlines and the passengers for access of this vaccination? And thank you.
Okay, I'll try to answer this question. It's not very clear for me, but what I can say is it's the responsibility of states, in fact, to give access, to acquire access, and to give access of vaccine to all Africans. And what we are doing at AFRAA is advocacy and giving awareness to our airline members. This webinar is part of our actions and our effort also. And we are working, as I told you, closely with the African Union Commission, with other stakeholders to push all action which can support our airlines. At the global level, I can say that IATA is also working with WHO, with ICAO, and with other global organizations on this issue, so that to defend the interest of our industry as well. And coming to the PCR test results, negative or positive, this is the responsibility also of states. I think that there are some standards put by the WHO, and the states have to follow these standards. maybe ACDC can give us more response regarding this test results. I will add something also, which is the PCR test cost. AFRAA has made a lot of call for African states to reduce the cost of PCR tests, because in other regions, globally, the test is free. And in Africa, in some countries, passengers are required to pay more than $150 per test. So this is really impeding the air transport today. So our actions is about advocacy, lobbying, and I can tell you since the start of this beginning, we are trying to push for support to our member airlines. And also AFRAA is member of this task force with ACDC and with other stakeholders, where we are discussing a lot of issues. So I will let maybe CDC Dr. Abdulaziz to complement if he wants.
No, thank you. You really answered the question very, very well. Let me assure the speaker from Sudan that all efforts are being made to ensure that vaccines are available to the at-risk population. There is like the Director General said, each country has its own prioritization for who gets vaccines first. But on the general, in Africa, we know that we are targeting people, the elderly, people with comorbidities, people, the healthcare workers. And I think a very strong argument, as I was listening to the presentation by the Director General earlier, I know there is a very strong argument for airline industry workers to be vaccinated, because they are on the front line as much as a doctor or a nurse or a community health worker is on the front line, because they are keeping our economy moving and working very hard to ensure that we do not grind to a halt. So there is a very strong argument, and I'm going to also the advocacy that airline industry staff should be vaccinated as frontline staff. Thank you. Over to you.
Thank you very much, Dr. Abdulaziz. And to complement your response to Sudan Airways, I invite Gausu Konate from AFRAA to give some additional remarks. Thank you.
Thank you, Maureen. Actually, the slide we have on the screen, if you look at that slide, which is trying to sell what come out from the multi-sectorial work, you will see in the last row, in the middle of it, with the C, it says clearly compliance with Article 40 of the International Health Regulation 2005, states should not charge travelers for intervention means to protect public health. That's why when SG presented, when he reacted, he said in Africa, the cost of PCR can be even 100 plus, while it is free elsewhere. And all our states are signatory to the text with this Article 40 there. So I think if participants want to help us, this infographic you have in front of you there, we'll share it with you. Make sure you taking to the authorities, the health authorities and air transport authorities in your respective countries, and ask them to behave in compliance with this Article 40. Because for the time being, it is their responsibility to make sure that the traveler don't pay and that the travelers get access to the vaccines. So we are doing it through the group of stakeholders who work on this document, but we want your participation also to help us to disseminate this so that we make sure that PCR tests are done without harassment to the travelers, including airline passengers, workers, and that state also accelerate access to vaccine to the travelers and to the front workers of the airline. Thank you, Maureen.
Thank you very much, Gausu. In the interest of time, we will take the last two questions, and these ones are directed to Africa CDC. The first question is, does Africa CDC guide African countries on new COVID strains, their threat level, and countries that should belong to a red list, similar to what UK is doing? That's from Kenya Airways, Martin Gitonga.
Thank you very much. I'm really impressed at the level of questions coming from this the participants of this webinar, and that's to show that I'm really happy. It shows interest in what is happening on the continent, and people are really thinking, not just us, but people are thinking of ways to ensure that we protect this continent against the effect of this pandemic. The short answer is yes, absolutely. Let me say that Africa CDC is supporting 6 centers of excellence on the continent, with pathogen genomics. That is, giving them the capacity and the capability to be able to do sequencing and increase the amount of sequencing they are doing, so that we can know whether we are already having variants, other types of variants, and be able to target intervention to those variants. We are supporting 6, like I say, Center of Excellence to do that. We will continue to provide that support until we have enough capacity on the continent to be able to use genomics and sequencing to determine the type of variants that are circulating in our continent. Let me also say that we are also, and again, this goes in partnership with airlines. We are supporting the transfer of specimens from countries that do not have these capacities to countries that have the capacity to do the testing and provide us with results. So you see, a lot has to do with partnership, and we will continue to do this in such a way that we'll be able to safeguard the public health of our continent. Thank you so much for this very important question. Over.
Thank you very much, Dr. Abdulaziz. And now the final question of the day from Kenya Airways again, Melissa Makoha. The question is, what is the main reason the numbers of acquisition of the vaccines remain low, especially from countries with major airlines in Africa?
I will not say the acquisition of the vaccines is low. If you look at our target, for the end of this year, we have a target of about 20%, and for next year to 60%. As you may have realized, countries scramble for vaccines, and of course, Africa may be disadvantaged in that scramble. However, through the COVAX and the AVAT facility of WHO and Africa CDC, we believe that the continent will continue to have increasingly access to these vaccines. It may not be at the level we want it to be. However, let me assure everybody on this call that people are working day and night. I can say it confidently because I'm part of it. People are working day and night to ensure that vaccines flow to Africa increases to a level that is acceptable to everybody. We are using every means available to us to ensure these vaccines come to the continent. And be rest assured that this will continue to be our priority until 60% of the population in Africa, not just in countries with airlines, the whole of the continent, we should be vaccinated. Thank you, and over.
Thank you very much. And now we come to the final part of today's webinar. Thank you very much, Africa CDC, for your kind support and for giving our participants a lot of insights, responding to their questions. We've received so many questions, and we are sorry that in the interest of time, we'll respond to the pending questions post-webinar. And now to wrap up today's session. We have gotten an analysis from AFRAA presentation on the CAT takeoff guidance, where travel through the COVID-19 public health crisis. The CAT phase 3 outcomes provide the timely, targeted, and essential guidance that the civil aviation system requires at this point in time. As the situation unfolds, possibly in the very near future, cooperation and alignment will even be more important to support our member states in adapting the new and ongoing challenges. We also had a presentation from Africa CDC on the Africa Against COVID campaign on saving lives, economies, and livelihoods, and safe reopening of borders. From this presentation, we got insights on the call to action that has been made by the African ministers responsible for health, ICT, and transport to African states to work towards harmonizing the pre-entry and exit requirements for cross-border travel. We've also gotten to get insights of the 3 main recommendations that are coming under this call to action. Recommendation on travel entry and exit requirements, recommendation on maintaining safe public health corridor before, during, and after travel, as well as recommendation on compliance to multinational treaties and regulation. AFRAA and the other industry stakeholders continue to work together collaboratively to support our airlines and to support our states on safe reopening of borders as we prepare for the restart of the air transport industry. From the open session, we had very good questions from the floor, and we thank you, our participants, for making the discussion very lively. Those questions that we were unable to address, we'll be happy to address them after the webinar. And for any questions that you may have that you could not ask us during today's session, please feel free to contact AFRAA Secretariat, and we'll be happy to redirect you to the Africa CDC team to respond to your inquiries. I encourage you to keep the conversation going. Thank you once again to the team that has helped us put up this webinar together. We'll be doing more webinars in the coming months as we continue to sensitize our stakeholders and airlines on the measures and developments that are taking place so that we can be abreast with the information necessary for us to restart our operations. The presentation and slides will be shared with all participants, as well as the recording after this webinar. We thank you once again for your participation, and I wish to also take this opportunity to inform you that tomorrow AFRAA is organizing, in partnership with Africa Finance Corporation, AFC, which is a Pan-African multilateral development financial institution, and also the Africa Commission for Africa, UNECA, a webinar to discuss financing challenges of African airlines and explore areas of support, as well as look at possible investment opportunities. DC will put the link on the chat box just now for you to register, those who are yet to register, and we look forward to your participation. The webinar will take place same time as today's webinar, 1300 hours East Africa time, which is UTC +3. And at this juncture, the webinar comes to a close. Thank you for your participation, and we look forward to interacting in the future. Thank you very much. Bye-bye from AFRAA Secretariat.
Thank you, bye.
Thank you. Bye.
And solidarity are at the core of our African DNA. These values have seen our airlines weather some turbulent skies and emerge stronger, and we are determined to keep this spirit going forward. Together, we will rise again to achieve better skies for Africa.
Dear travelers, to keep you safe, airlines have made some changes to flying. If possible, check in online and use the self-serve baggage drop at the airport. For the sake of your fellow passengers, please wear a face mask and respect social distancing. Health checks may become part of your journey. We're ensuring thorough deep cleaning and disinfection of all areas, from the lounges to the washrooms and especially the plane itself. And airplanes have the advantage of hospital-grade HEPA filters that remove 99.9% of germs and viruses. So while we know travel has changed, your journeys are still out there.
Aviation in Africa is a key driver of economic growth and social development. This is a sector that creates jobs, facilitates trade, and connects our people and magnificent cultures to the world. Due to the COVID-19 pandemic, however, skies have become quiet in Africa and across the globe as our nation suspend most passenger air transport to protect our families and communities. Although it is an unprecedented and challenging time for all of us, resilience, courage, and solidarity are at the core of our African DNA. These values have seen our airlines weather some turbulent skies and emerge stronger, and we are determined to keep this spirit going forward. Together, we will rise again to achieve better skies for Africa.
Dear travelers, to keep you safe, airlines have made some changes to flying. If possible, check in online and use the self-serve baggage drop at the airport. For the sake of your fellow passengers, please wear a face mask and respect social distancing. Health checks may become part of your journey. We're ensuring thorough deep cleaning and disinfection of all areas, from the lounges to the washrooms and especially the plane itself. And airplanes have the advantage of hospital-grade HEPA filters that remove 99.9% of germs and viruses. So while we know travel has changed, your journeys are still out there.
Aviation in Africa is a key driver of economic growth and social development. This is a sector that creates jobs, facilitates trade, and connects our people and magnificent cultures to the world. Due to the COVID-19 pandemic, however, skies have become quiet in Africa and across the globe as our nation suspend most passenger air transport to protect our families and communities. Although it is an unprecedented and challenging time for all of us, resilience, courage, and solidarity are at the core of our African DNA. These values have seen our airlines weather some turbulent skies and emerge stronger, and we are determined to keep this spirit going forward. Together, we will rise again to achieve better skies for Africa.
Dear travelers, to keep you safe, airlines have made some changes to flying. If possible, check in online and use the self-serve baggage drop at the airport. For the sake of your fellow passengers, please wear a face mask and respect social